Good evening, good morning, good afternoon, depending on where you are in the world and attending this conference. My name is Kwena Nkoko. I'm the Group Head of Health in the city of Tshwane, South Africa. Let me take this opportunity to really thank the Global Commission on Drug Policy and City of Amsterdam for having organized this historic event and having invited us as the city of Tshwane to make a contribution in as far as our experiences as well as challenges are concerned around drug policy reform at a city level. As the city of Tshwane, we believe strongly that drug policy reforms and practices must be evidence-based and must be driven at a city level because of the following facts. One, we know that the impact of drugs as a result of policy gaps in the policy value chain are directly felt by the cities. Cities are the first point of contact for government, and citizens expect that cities must lead in the conceptualization as well as implementation of policy reforms to the benefit of the citizens. Such policies are likely and must be anchored upon an agreed set of principles as well as values, which include, amongst others, human rights, intersectoral collaboration, and they must be contextually relevant as opposed to being uninformed and misguided by the ideologies. To this end, the city of Tshwane took conscious, sometimes unpopular as well as controversial policy decisions, which include but not limited to the following, with the aim to practically implement supply, demand, as well as harm reduction policy directives. One, COSUP, which is Community-Oriented Substance Use Program, was born out of the evidence that we have gathered from Community-Oriented Primary Care, abbreviated as COPC approach. By the way, what is COPC? COPC approach simply means that people get assessed and their care get coordinated from their homes and families. Community-Oriented Substance Use Program, which is abbreviated as COSUP, was started and adopted as a policy position of the city. As indicated earlier on, this was as a result of evidence that we have gathered from the COPC approach. What then is COSUP? COSUP, in short, is a comprehensive evidence-based approach program that includes, amongst others, training, harm reduction, supply reduction. It includes also needle and syringe programs that we run from our 16 sites in the city. To date, more than 5,000 people have been reached, and 750 of these people are on our OST. What is OST? That's our opioid substitution therapy. The second achievement that we have reached as a city of Tshwane in leading policy reforms, we have introduced the concept of street medicine. Street medicine was introduced as a result of the high level of homelessness. Whilst the problem of drug and substance abuse exists in all communities, it is more impactful on the homeless people. Hence, there was a necessity for us to introduce street medicine, which takes care of the HIV and TB and other infection and related challenges for homeless people. How then did we influence local and national policies? Drawing from the city's policy and practice, the following successes have been registered. The National Department of Health is currently developing guidelines for the implementation of an integrated harm reduction approach, including opioid substitution therapy, as well as integration of substance abuse care within the HIV, TB, and hepatitis C program, which are the common challenges in as far as substance use is concerned. Both the National Drug Master Plan as well as the National Strategy on HIV and TB now includes evidence that we have gathered through our COSUP program in the harm reduction interventions. This has been a shift from a punitive war on drugs as well as abstinence, which used to be the approach within our city, and to an approach where there's collaboration between various stakeholders such as police as well as Central Drug Authority and so forth. The City of Tshwane has also, as a milestone, approved an NGO funding policy, which support the NGOs that are doing a lot of important work in the supply, demand, and harm reduction space. COSAP continues to be one of the greatest platforms for service delivery as well as evidence generation. And we are glad that it has grown to where it is today as an evidence-based policy position for the city. Of course, in all policy decisions that one needs to implement, there is resources that are required to back up the policy implementation. We are currently, of course, experiencing financial constraints which limit our ability to expand our good programs to the citizens. To this end, as a city, we are collaborating with other stakeholders to lobby for review of funding policies at the national and provincial level. Coordination of care is one of the other complex challenges we are faced with. And to address this, the city has initiated a program to integrate care at a community level with the help of and the use of geoinformatics, where service as well as organization mapping, coordination and referrals are done through various electronic systems. We see our approach to addressing these challenges as going to be helpful going into the future and concretize the gains we have made so far. In conclusion, let me take this opportunity to thank everybody for your attention and indicate that as the City of Tshwane, we really advocate for cities to take leadership and become the centers for conceptualization as well as development of evidence-based and contextually relevant policies at local level. I thank you.